Hi, my name is Lindsay Jones and I'm going to be doing a demonstration here on how to use the virtual IV. The first thing you want to do is make sure that you wash your hands really good, and then you want to put on gloves because the instrument's really sensitive to the oils on your hands. First thing you're going to have your students do is you're going to come in here, and this will already be pulled up for the students, and you want to put in the username. The students would have already gone through the tutorial, so I'm just going to show you the actual scenarios. You're going to click in hospital, and you're going to click your patient case scenarios. You have 4 scenarios to pick from. You have food poisoning, abdominal pain, fever, and gastroenteritis. The goal for each of these scenarios is to get a 90%, but the students do not have to achieve a 90% to pass the virtual IV experience. Okay, we are going to go with the food poisoning first. You click your arrow to start, and then the screen will give you the case scenario. This is a 56-year-old female presents at your urgent care clinic complaining of continuous vomiting for the past hour. She has eaten hot dogs from the street vendor and developed abdominal pain and vomiting shortly thereafter. Her skin is pale and clammy. She denies chest pain and shortness of breath. Her electrocardiogram, x-rays, and lab values are all within normal limits. She has a history of hypertension, high cholesterol, for which she takes medication. She's allergic to penicillin and bee stings. For students, they want you to look at this case scenario and decide what type of IV is going to be appropriate for this patient. They also highlight the things that you want to pay close attention to, which is vomited 3 times in 1 hour, abdominal pain, and allergic to penicillin. These are her vital signs. Respirations are 20, BP is 146/90, heart rate 96, temperature was not taken, and oxygenation was not recorded. You're going to click your arrow to start your scenario. So the student is going to want to pick what site is best for this scenario. So you can click either the left or the right arm. I'm going to go with the left, and then they want you to pick the hand, the anticube, the upper arm, or the prominent forearm. For this, because she might need IV antibiotics depending on what's going on, I'm going to go with the forearm. And then you're going to click the arrow over. This is where you're going to start to pick your supplies. You can choose gloves, and you can choose more than one. You can choose whatever you're going to need to go through the process of starting an IV. So I'm going to choose goggles, Tegaderm, Band-Aid, tourniquet, gauze, and you also want to pick the right catheter size. So I'm going to go with a 22 gauge and maybe a 20, just depending on how big the IV is when I palpate. I'm going to pick tape. I'm going to pick my extension set. I'm going to pick that. I'm going to pick IV fluids, and then I'm going to pick something to prep the area with. And like I said, you can pick more than one, you can pick multiple. And then once you've picked everything that you think you're going to need for the scenario, you're going to click your arrow over. Okay, so now your scenario starts. So you can see at the top of the screen that your time has started. You want to do all this within 10 minutes. Okay, so the first thing you want to do here is you want to identify your patient. You're going to click to identify your patient. It has been correctly identified. Next thing you want to do is inform your patient of the procedure. Patient has been informed. The next step you want to do, of course, is wash your hands. So you're going to wash your hands. This basically takes you step by step through the process. Next thing you want to do is put your PPE on. So you're going to put your gloves and your goggles on. Okay, so now you're prepared to start the process here. The next thing you want to do here in your scenario is you're going to put your tourniquet on your patient. Now remember, the tourniquet, you do not want to have one any longer than 2 minutes. So once you start the process here, you really kind of want to move things along. You're going to take your tourniquet and you're going to put it about 4 to 2 inches from where you're going to go. So I'm going to go here, put my tourniquet on, and you're going to come over here and you're going to click palpate, and you're going to try to feel where you think a vein is. And you can really feel the vein pop in different scenarios. So I am not feeling anything. Let's try over here. Right there. Okay, and you can see that when you hit the vein there, that you can really see it popping. And you got to remember your time with your tourniquet. Now I'm going to come over. I'm going to prep my area. You're going to want to take small, slow, circular motions to get that nice and clean. Okay, then you want to put this in your trash can. Next thing you want to do is come over here and we're going to pick our IV now. That looks pretty big, so I'm going to go with the 20 gauge. You're going to come over and you're going to kind of guess where you're going to go with the IV. Right there looks good. Next, you're going to take your IV catheter here, and you want to make sure that you have bevel up. I don't know if you can see or not that little tiny dip in there, but that is supposed to be your bevel up. You're going to take it and you want to make sure that you're pulling your skin taut. You're going to put your IV in, and when you put it in here, you're going to kind of feel it grab it, and once you grab it, you're going to let go, come down and warn your patient of a stick. And now you are prepared to go in. Make sure you're at your right angle, which is 10 to 30 degrees. And you're going to go into, and see how I got a flash there? I'm in. So now I want to go about 1/8 further in. And I'm going to slide this. And as I'm doing this, I want to come up and add pressure. Take off my tourniquet, put this in the sharps container. Take off my tourniquet and come over and grab my setup here. I'm grabbing my setup, click it in, let go, and it's going to flush it for me. Okay, take this, put this in my sharps container. Now I have to secure my IV. So I'm going to come over here and grab my Tegaderm. Oh, pretty sure I disposed of it, but there we go. Take my Tegaderm, I'm going to place it over my IV site. It's placed. I'm also going to come over here and I'm going to secure the IV with some more tape to make sure it stays on. Now I'm going to set my patient up with their IV fluids. I'm going to come over and set them up. The patient is set up. I'm going to now take off my gloves, dispose of them in the trash can, take off my goggles, and then I'm going to wash my hands because my procedure is over. When you think you've completed the whole procedure and you are finished, you're going to click over here to the arrow and it'll take you to the debriefing screen so we get to see how well I did. Okay, so I got a 92%. Like I said, we're aiming for 90, so I did a pretty okay job. As you can see, the debriefing here is going to tell you what you did. Correct cannula, correct venipuncture. And it's going to tell me some of the things that I did wrong. So procedure completed in appropriate time. The one thing I got dinged on is I left my tourniquet on too long. Like I said, I left it on for 2 minutes and 9 seconds. I was 9 seconds over. So I probably would have done better if I wasn't doing this video. But as you can see, it'll tell you. And then for something that you did wrong, if there's a little movie clip here, you can click it. It'll play the movie to demonstrate what you did wrong. You'll have your headphones on, of course, so you'll be hearing the audio as it's going, but it'll explain to you what you have done wrong. So then the next time you try it, you know how to fix that problem. Okay, and then once you've completed this, and you've got your 90, or you've done it one time and you're done, you just click through. Please put the cat, oh, it's gonna want you to put this back together, and let me show you here. I have it labeled for you. The black dot goes with the black dot. Back together, back on here. Click OK, and it'll take you back to your patient cases scenarios, and you can move on to the next one. So that was just a quick introduction on how you do it. Like I said, it's going to take a couple of times for you to get used to how it feels and to practicing, but the more you practice this type of skill, the better you're going to be. Thank you so much for listening, and enjoy your scenarios.